Staff at Shaftesbury's Boots store have been praised in Parliament by the Health Minister Stephen Kinnock for picking up the extra workload caused by the ongoing farce at the town's Jhoots pharmacy, unable to issue prescriptions because they've not had a pharmacist on duty for weeks.
I pay tribute to the employees in the Boots, which is close by the Jhoots, that is not providing the service that's required, and we really do appreciate that.
Thanks echoed by Shaftesbury's MP Simon Hoare.
Staff at Boots who are picking up such a huge amount of slack because the Jhoots isn't there.
The Abbeyview Medical Centre has previously expressed its frustration at the extra pressure on its staff in trying to rearrange prescriptions, and the NHS in Dorset has suggested patients shop around and go elsewhere, a response that perhaps you might consider wishy-washy, but it was apparently strong for them. Our MP isn't mincing his words. He wants action.
Sometimes these things need a kick up the arse. There has to be some speedy action to try and get Jhoots out of the landscape, as it were.
This isn't just a Shaftesbury issue. This debate in Parliament was prompted by a question from West Dorset MP Edward Morello, who's had similar problems in his area, and North Somerset MPs also raised similar concerns. The legal framework means you can't just set up a pharmacy. There are effectively licences for each area. Shaftesbury has two, one held by Boots, the other by Jhoots. That means even if you opened a pharmacy, you couldn't just hire a pharmacy and start dispensing medicine. The issue is that Jhoots holds that contract, but they're not delivering the service. And when the legislation was drafted, nobody foresaw a situation where a contract holder simply couldn't deliver.
This is a clear breach of contract, but I'm told by our ICB it doesn't fall within contract law.
The ICB should know that's the Integrated Care Board, the local NHS organisation responsible for planning and funding health services in our area.
The regulations are mute on this point because the circumstances that Jhoots find itself in was never envisaged when the regulations were written. That's the problem which the Minister has identified. There does seem to be some timidity amongst officials and others with regards to the overhanging threat of a judicial review were the government to act in extremis to introduce some urgency to it. I would urge the Minister to take that risk.
Minister Stephen Kinnock responded to Simon Hoare's comments.
He has rightly identified the problem, which is that the regulatory framework is strong on pharmacists, strong on pharmacist premises, strong on pharmacy staff, but it seems that there is something of a gap when it comes to regulating pharmacy business owners. That is a gap that has been identified. I have asked I've commissioned my officials to work on that at pace, and I would happily keep him updated on that work.
Stephen Kinnock said the NHS Integrated Care Boards and the General Pharmaceutical Council could potentially strike off pharmacies affected. I spoke with MP Simon Hoare after the parliamentary debate.
There is an anxiety from from local ICBs and from within the department about government marching ahead, acting swiftly, and maybe then finding itself facing a judicial review by Jhoots. But I think that is actually a risk that is worth running, because certainly in the court of public opinion, this is a clear and signal failure of the delivery of perfectly legitimate expectations on services with regards to getting your prescription dispensed.
So basically there needs to be either some bold action or legislation to effectively get Jhoots out of Shaftesbury.
I don't think it's a question of either or, Kerry. I think there's a number of levers to pull and buttons to push. That of itself then doesn't reopen the premises from which they are trading. A new operator, a new owner has to be found to do that.
As Simon Hoare sees it, there are broadly two options for Jhoots.
Either them getting their house in order and getting reliable 9 to 5 days a week prescription dispensing services back up and running. Now that, if they can do it, great. It looks highly unlikely, and certainly talking to colleagues here in the Commons, they think that is highly unlikely as well. Regulations need to be refreshed and updated to reflect what is in essence commercial failure and or commercial collapse. And the regulations don't cover those currently.
And in the Commons, the Minister said they're looking at every option.
I can assure him that absolutely nothing is off the table.
You've probably seen the glossy government advertising campaigns trying to reduce pressure on GP practices by promoting pharmacies and pharmacists as advisors on certain medical conditions. Well, of course, that can't happen with Jhoots. There's no pharmacist there, and that puts extra strain on the Abbeyview Medical Centre and staff at Boots. Again, inoculations that some pharmacies offer, COVID and flu jabs, can't be delivered without a qualified pharmacist at Jhoots. There's a concern from Simon Hoare,
which is the impact this has for patients in terms of getting non-GP but sort of, well-qualified medical advice and guidance.
So effectively at the moment, it's not dispensing, so it's selling things you can buy in Boots or Superdrug. It's a shop, isn't it? Do they get money from the government to provide the pharmaceutical dispensing service? Are they getting that money even though they're not doing it?
My understanding is that there are no payments being made to Jhoots by any public body at the moment.
So it could just be a waiting game because the whole thing might just collapse if there's not enough money coming in because nobody's going there to buy their cough sweets.
Well, look, there's not enough money coming in at the moment because staff are not being paid.
And Simon Hoare told Parliament he was worried about solo working at Jhoots in Shaftesbury because staffing has been trimmed back.
There's a danger to the one member of staff who is on duty because there are prescribed drugs on the premises.
Alfred first reported problems at Shaftesbury's Jhoots in April 2024, but it seems these problems are emerging across the country. The Jhoots chain was created by Sarbit and Manjit Jhooty. They picked up pharmacies from the former Lloyd's pharmacy chain when that failed 2 years ago. Simon Hoare asked Parliament whether something could be done for the pharmacies dealing with increased queues and more dispensing because of Jhoots' inability to issue prescriptions.
I wonder what additional support the department can give to those existing providers like Boots who are picking up the slack, particularly during the winter peak with regards to advice to patients and also administering vaccines.
So have you got any sense of how long it's going to take before, what people want to know, before Jhoots are out and somebody else is in?
Honestly, could not say. There are a couple of cases which are sort of slightly ahead of Shaftesbury in the pipeline, and if they are adjudicated and whatever action is agreed upon is deemed to be beyond legal challenge or judicial review by Jhoots, that of itself may then provide that little bit of turbocharging. There's not a constituency MP affected who wouldn't love to have a sort of magic wand where we could plot the path and devise the solution and deliver the solution in pretty quick order. There is a process, but I think what all of us were saying to the Minister, sometimes these things need a shake of the reins, and you say, right, there is a process, but let's really now put our foot to the floor, make that process as quick as possible.
Since last year, all of our attempts to contact Jhoots about these issues have been met with no response. We hope to speak with some former and current Jhoots staff about their experiences and the hopes of eventually getting paid in the next few days here on Alfred.